100 Pregnancy Tips. 1. Don't rush yourself. Prior to planning pregnancy, you should learn more about the things involved in getting pregnant. It involves carrying a baby inside you for 9 months, caring for a child for a number of years, and many more. Consider these things, so that you can properly assess if you are ready for pregnancy. 2. Planning for pregnancy. Learn more about pregnancy, and seek medical help if you need to. Getting pregnant may not come as a walk in the park to some couples. However, with proper planning, such as visiting your doctor for tips and following healthy habits, you should be on your way to having a child. In addition, make sure to avoid certain things that can affect your pregnancy, such as alcohol and tobacco. 3. Increase your chances for getting pregnant. The more you make love with your spouse, the more chances you would have in getting pregnant. However, you should also make sure that you are both in top condition. Thus, you should exercise regularly. Aside from that, you should also eat a well-balanced diet, and get enough rest. 4. Be ready for the challenges. Pregnancy can let you and your spouse come across many challenges. Aside from feeling sick and tired more often, you may also experience a lot of mood swings. Thus, you should have constant communication with your spouse, so that he can also support you effectively. 5. Dealing with changes. Once you get pregnant, you would have to go through certain changes. One of which is gaining weight, which can affect a woman's self-esteem. However, you should consider that gaining weight is part of the normal process of pregnancy, which also assures that your baby is healthy. Aside from that, after giving birth to your child, you can easily shed off the excess weight through dieting and exercising. 6. Knowing your ovulation schedule. One of the keys to getting pregnant is knowing your ovulation schedule better. You can easily determine it basing on your monthly menstrual period. However, if you have a regular period, then it can become challenging. Visit your doctor for it, so that you can have better guidance. 7. You are not the only factor involved when it comes to getting pregnant. You should also keep in mind that in order to get pregnant, your partner should also take care of himself. Aside from avoiding unhealthy practices such as smoking, drinking alcoholic beverages, or staying late at nights, your partner also has to have regular exercise. Additionally, he should also avoid hot baths and jacuzzi. 8. Know when to see a doctor. If it has been a year, and you are still unsuccessful in conceiving a baby with your partner, even if you are both healthy, then it may be time to see a doctor. Seeing your doctor should help you determine whether there is an underlying medical problem behind it. Aside from that, he can also offer you the right solution for your problem. 9. Know the signs of pregnancy. It is very important that you familiarize yourself of the signs and symptoms of pregnancy, so that you can immediately take necessary actions for it, such as visiting a doctor. Some of the signs would include lost or delay of your menstruation, feeling nausea, and such. Once you notice the signs, don't keep it to yourself and tell your partner about it. 10. Pregnancy tests. There are lots of pregnancy tests available in drugstores and supermarkets these days. To see if you are pregnant, you can easily purchase one and use it. If the test shows that you are positive for pregnancy, don't hesitate to visit your doctor, so that you can have it confirmed. 11. Dealing with spider veins. Many women call their stretch marks as spider veins, because for its appearance. Keep in mind though that in most cases, you may get affected by it, due to the fact that you would gain weight, and your skin would get stretched. However, you should not worry too much about them, since they usually disappear in just a few weeks' time after giving birth. 12. Itchiness in your belly. In your 5th, 6th, or 7th month of pregnancy, you may experience itchiness in your belly, especially in the side of your stomach. The possible causes behind this would include the stretching of your skin, and its dryness. To counter it, you can use a mild moisturizing cream after taking a bath. However, it usually passes away in just a few number of days. 13. Nosebleeds and bleeding in your gums. In your first trimester, you may notice that when you brush your teeth, your gums would easily bleed. Aside from that, you may even experience nosebleeds. This is actually quite normal for the first trimester, since the hormonal changes in your body can cause more blood to flow in your mouth and even in your nasal passages. Thus, you should not worry too much about them. However, don't hesitate to call your doctor if you feel that you need to. 14. The importance of folic acid. Eating foods that are high in folic acid is actually very important prior and during pregnancy. The reason for this is that it can help prevent certain defects on the neural tube. Thus, it is time that you eat more green leafy vegetables, as well as folic acid fortified cereals. Aside from that, you can also take supplements for it. 15. Be ready for the changes. Each week in your pregnancy period, there are certain changes that you can prepare yourself for. For example, it is usually at the 6th and 7th weeks that you would experience mood changes. Aside from that, when you approach the 8th week, that is also the time when you may have morning sickness. 16. Increase in sex drive. During the second trimester of pregnancy, you can experience increased sex drive. In other words, you may want to make love with your spouse more often. Since this is normal, then there is no need to worry about it. Aside from that, your baby actually would not get hurt when you do the deed with your husband. The only times when doctors do not recommend it is when a woman is experiencing pregnancy problems, such as bleeding. 17. Taking calcium supplement. Once your baby starts to grow inside you, he will need more calcium for proper development of his bones and teeth. Thus, it is best if you have a good calcium supplement on your side. Without good calcium supplementation, your baby would have to absorb calcium from you, which can make you deficient from it. Aside from taking calcium tablets, it is also a good idea to drink more milk, and eat more cheese and spinach. 18. The 10th week. When you are at the 10th week of your pregnancy, you may experience some pain in your breast. Aside from that, it can also be the week when you can get tired easily. More importantly, it is usually the time when the fetus decides whether it will be a boy or a girl. 19. Dealing with constipation. Once you get pregnant, your body would actually produce more progesterone, which can slow down the movement of your intestinal tract. This can cause constipation, aside from the fact that your vitamin supplements can also add more to it. Thus, it is best if you drink more water, such as having 8 or more glasses of it per day. Aside from that, it is also wise to eat more fruits and vegetables, since they are loaded with moisture and fiber. 20. Information you need to get from your doctor. During your first or second consultation after your doctor confirms your pregnancy, you should ask him important questions. These questions should pertain to when you are due for giving birth, vitamins that you need to take, the circumstances when you need to call him, and such. Acquiring answers to such questions is very important, since it can provide you with better guidance. 21. Quitting smoking. Some expectant mothers can be smokers. Thus, if you are one of them, then you should know that it is time to quit the habit. Smoking can actually become one of the hindrances of a healthy pregnancy. Thus, you should seek help from professionals on how to stop your smoking habit once and for all. 22. Having pre-existing medical conditions. If you have certain medical conditions or if your family has a history of having certain kind of disease, then you make your doctor aware of it. Informing him about it should be done at the first or second consultation. This way, he would be able to provide you with recommendations, which you need to follow to have a normal delivery. 23. Iron. Having iron supplementation is very important during pregnancy. Your need for iron when you are pregnant actually doubles, due to the fact that your blood volume expands, so that you and your baby's needs for would be accommodated. Aside from taking supplements for it, it is also vital that you include food items in your diet that are loaded with iron, such as lean meat, spinach, and more. 24. Eating citrus fruits. Eating more fruits that are loaded with vitamin C is actually advised when you are pregnant. This is because vitamin C is important when it comes to fighting off infections, as well as to help your baby in having healthy skin, gums, and teeth. In addition, this vitamin is also needed by your body, in order to absorb iron effectively. 25. Preventing malaria. One of the most harmful diseases that you need to prevent during pregnancy is malaria. Malaria can actually cause birth defects, premature birth, miscarriage, and other pregnancy complications. Thus, it is important that you minimize traveling to malaria-infested places when you are pregnant. Aside from that, you should also avoid getting bitten by mosquitoes by staying indoors, as well as by wearing long-sleeved shirts. 26. Back pain. Experiencing back pain is actually quite normal during pregnancy. Back pain may sometimes cause difficulties to the mother during the delivery time, which is why it is best that you become more familiar about how to gain relief from it. Thus, you should not forget to ask your doctor about it, especially if you begin to feel pain in your back. 27. Swimming during pregnancy. When you are pregnant, it does not necessarily mean that you have to give up your favorite activities like swimming. Swimming can actually offer you with lots of benefits even when you are pregnant. It can provide you relief from back pain, aside from making you sleep better. In addition, it can also treat your swollen ankles. 28. Practicing yoga. Pregnancy can cause you back pain as well as the inability to relax. Thus, it is time that you learn how to do yoga. Yoga can actually help you feel more relaxed, which is good since it can help you get the rest that you need. Aside from that, with its light stretching exercises, it can ease your back pain and help you during labor. 29. Cycling when you are pregnant. If you are pregnant, you may have to give up your hobby of riding the bike outdoors temporarily. However, if you really want to do such activity indoors, you can perform it with the use of a stationary bike. It is actually safe and it can provide your body with the exercise that it needs to prepare you for childbirth. 30. Weight training. If you have been accustomed to doing some weight training prior to getting pregnant, then it may be safe to do it when you are already an expectant mother. However, you should go easy on it for the time being. Avoid those routines that can make you put more pressure on your body, since that is not a good idea. 31. Eating more carrots and green leafy vegetables. When you are pregnant, it is best to fill up your diet with carrots, green leafy vegetables, as well as sweet potatoes. These food items are actually loaded with vitamin A, which is good for the developing baby. It will help your baby develop good skin and healthy eyes. 32. Getting enough exercise. Even when you are already pregnant, it is still best that you get enough exercise, not just for you, but for your baby as well. Getting enough physical activities each day can help in preparing you for the delivery time. Aside from that, it can also lower your risk to having miscarriage. 33. Learn more about pregnancy. Aside from asking your doctor a certain number of questions about pregnancy, you should also do your own research about it. By learning more about pregnancy, you will become more familiar of the changes that you would undergo with it, which can get you prepared more effectively. Aside from that, it can also prevent you from becoming too worried when you experience certain changes in your body. 34. Taking vitamins when you are pregnant. It is true that it is a good idea to take vitamins when you are pregnant. However, the supplement should not be just any kind of vitamin mineral product that you can come across with. It is best that you go with a prenatal vitamin product for it. It should contain adequate amounts of folic acid, and should be prescribed by your doctor. 35. Healthy lifestyle changes. Once your doctor confirms that you are pregnant, you should make healthy changes in your lifestyle. For this, it is a good idea to get your spouse involved with it as well. Thus, if you are going to make some changes in your diet or you are going to go through certain exercise routines, then it is best if you can do it together. By doing that, it would become more fun and exciting. 36. Changing your practitioner. If this is not your first time to give birth, but you need to change your practitioner for some reasons, you should do so even before you get pregnant. This is better since it can give you time to adjust with your new practitioner, before you start experiencing pregnancy symptoms. Aside from finding a new practitioner early, you should also go through proper selection process, so that you can find someone whom you are really comfortable with. 37. Finding the best doctor. When it comes to becoming pregnant for the first time, it is best if you have a doctor that you can consider as the best. The best doctor can give you comfort whenever you feel worried about yourself or the baby. Thus, it is wise to ask your friends for their recommendations, and interview a number of doctors, so that you can find the one that would suit you best. 38. Don't hesitate to ask your friends and relatives about pregnancy. If you have friends and relatives who have already given birth, they should be some of the persons you should talk to when it comes to being pregnant. This is because they can give you a lot of tips about it through their experiences. Aside from that, they can also give you more valuable information about parenting and caring for your child on his or her first few days in the outside world. 39. Being pregnant does not mean you should not visit your dentist anymore. When you are already pregnant and it is your schedule to visit your dentist, then you should still follow it. Keep in mind that visiting a dentist is actually one of the healthy practices that you can follow when you are carrying a child. Your dentist can ensure that you are able to maintain a healthy set of teeth, which can contribute to your overall health condition. 40. Be more concerned about chemicals. There are certain chemicals that you can be exposed to at work, in your own place, or anywhere, which can be harmful to you or your baby. Thus, you should be mindful of them once you become pregnant. By becoming more environmentally sensitive, you can ensure a safer pregnancy. 41. Visiting a medical professional before you are pregnant. If you are with a medical professional while you are still trying to get pregnant, and you are unsure whether you are or not, then it is best to inform him that you may be pregnant. This is because you may be at the doctor's office for certain tests, which may be related to your employment. By telling the medical practitioner of the possibility that you are pregnant, he can prevent you from getting exposed to tests or chemicals, which may harm your baby. 42. Get enough rest. Aside from getting enough exercise, you should also get enough rest when you are pregnant. Getting enough rest provides your body with ample time to recuperate. Aside from that, it would also make your baby feel more comfortable inside your womb. Thus, whenever you feel like napping, you should do it. 43. Make use of the internet to gain more information about pregnancy. There are lots of websites today, which you can consider as your resources when it comes to pregnancy-related information. Most of these web portals are operated by medical practitioners themselves. The best thing about it is that you can do your research about becoming pregnant at home, and you can even post your questions on some of these web pages. 44. Do some online shopping. If you are just a few weeks due for delivery, then you may want to shop for some items that you may need for it, such as infant clothing, diapers, and more. Since it can become stressful to go shopping during this time, then you should take advantage of your internet connection. Do your shopping online, so that you can simply let your hands do all the walking. 45. Start a blog about pregnancy. If you are one of the millions of people who love to spend some time on the internet, then you can start a blog about your pregnancy if you want to. Coming up with a blog about pregnancy can actually help you document your day-to-day experiences about it. Aside from that, it can also attract other pregnant women who are willing to exchange valuable tips with you. With that, it can make your pregnancy more bearable and enjoyable. 46. Listen to good music. Being pregnant can make you more impatient at times, or you are more prone to stress even with just encountering a very slight problem. Thus, you should learn to relax better, which you can do by listening to good music. Music can help in soothing your nerves, which will not just provide benefits for you, but for your baby as well. 47. Read a good book. This is your time to expand your horizons by reading another book or novel. When you are pregnant, you can have lots of spare time, which you may not know how to spend. However, with a good book on your side, you will be able to spend your extra time using your imagination, and it can help you get some sleep or feel more relaxed. 48. Use non-medical remedies for certain ailments. Whenever you experience constipation, nausea, or heartburn, you should make use of non-medical remedies for them. The reason behind this is that certain medicines may not be good for you while you are pregnant. Thus, it is time that you become more familiar about homemade homeopathic remedies for such ailments, such as drinking lots of water, using herbs, and many more. 49. Add more calories to your diet. Although you may be quite conscious about your weight, you may have to let go of that when you are pregnant. This is because it is essential that you gain some weight during pregnancy to ensure the normal development of your child. Thus, it is time to add some calories into your diet until you are able to give birth. 50. Always follow your prenatal appointments. Prenatal appointments are scheduled properly by your doctor for many reasons. One of which is to closely monitor the development of your child. Thus, it is imperative that you keep your prenatal appointments with your doctor. Aside from effective monitoring, this can also help detect certain problems, which can be addressed on immediately.